Let's talk about the log roll. If you have back pain, you've had abdominal surgery, back surgery, C-section, or even sternal precautions because of heart surgery, you have to do what's called the log roll. And when you log roll in and out of bed and you're teaching patients how to do that, it's challenging. It can be difficult. It can be hard to understand. But if you can keep in mind a couple of principles, it really does make a big difference. First thing is you have to remember the teeter-totter principle. When one side goes down, the other side goes up. It has to happen simultaneously for that leverage. Without that leverage, you actually end up working harder than you should. So when our patients are here and we tell them to lay down, a lot of times we have to help them with their legs. Or vice versa, when they're here, we tell them to roll to their side, and then we tell them to kick their legs off and now sit up. We've lost the leverage. Legs have left the bed. They haven't even started sitting up. It has to happen at the same time. In addition to that, when they're sitting up, if they can use this elbow and this hand and kick their legs off at the same time, it makes a huge difference. In addition, when you look at the teeter-totter principle, you should also keep in mind momentum. So when patients are struggling to stand, a lot of times they'll rock. They'll do this rocking motion to help them gain that momentum to be able to stand. So when we look at combining the two, this is what it should look like. So when we go to lay our patients down, we're going to do a rocking of 1, 2, and then 3. Everything happens at once. When they go to sit up, we have them rock, and then on 3, they're going to use this elbow and this hand, and we're going to go 1, 2, 3, and everything happens at once. Is this going to work for everybody? Absolutely not. You have to make sure you're on the same page with your patient. If they normally sleep in a recliner at home, they're not going to want to learn this. If it's somebody that doesn't want the independence, doesn't want to be able to go out of get to the bathroom when they need to go, or be able to get out of bed when they want to, they're not going to be interested in learning. So making sure you're on the same page as your patient makes a huge difference. I've had patients that were 250 pounds with sternal precautions, and I was doing 50% of the work. Within 3 days, they were independent, but they had to learn the method and figure out how to use it as a tool to be able to help them get up. So now we're going to practice real life so you can actually see it in action. Okay, so here we go. We're going to rock him, and on 3, we're going to watch this arm because it's going to scoop his legs. We're going to go 1, 2, and then 3. When I go to get him up, I'm going to have him bend up both knees. I'm going to have him rock towards me, and I want him to use this elbow and this hand to push himself up. On the count of 3, you're going to kick your legs off. You ready? 1, 2, and then 3. And then I'm not having to lift him as much as it's a push. It's way easier. If you haven't seen me before, I'm Carrie, here to help you learn how to move patients with ease.